Hello and welcome. I'm Yvonne Judge, an independent marriage and family therapist licensed in the state of Ohio. I'm an EMDR certified therapist and an EMDRIA consultant specializing in traditional EMDR, attachment-focused EMDR, EMDR Flash, and EMDR 2.0. Currently, I'm a doctoral candidate pursuing my PhD in marriage and family therapy at North Central University, where my research and dissertation focuses specifically on the intersection of EMDR and relationships. I'm also DBT and personality disorder certified, and I serve as an EMDR consultant, supervisor, and AAMFT supervisor. To support my clients' diverse needs, I draw from a wide range of clinical models including DBT, EMDR, hypnosis, boundaries work, family therapy, Gottman method couple therapy, and emotion-focused therapy. My practice is based in Columbus, Ohio, where I see clients both in person and online across the state. And I believe in using what works best for you as an individual rather than trying to fit you into a box of my making. EMDR stands for eye movement desensitization and reprocessing. And to understand why EMDR is such a powerful tool, we need to start with how our brains process difficult or traumatic experiences. When we have something happen to us that's traumatic or we have severe stress, those memories kind of sometimes get stuck in our body or in our nervous system, and they don't react the way older memories do normally. So for instance, most people remember falling off their bike as a kid. You remember you fell, maybe you skinned your knee, and it was not fun. It sucked, right? But it's not up in your face. You think about it, you're not enjoying the memory, but it's also not hurting you in the now. On the other hand, if maybe a bully had pushed you off that bike, broke your arm, stole the bike, now you might actually have an issue, So if it's the former and you just fell off the bike, no big deal, you might pass a bike store, no big deal. On the other hand, with that traumatic memory, you might pass a bike store, see a bike similar to the one that you had when you were a child that was stolen, and you might have hypervigilance, you might have a panic attack, you might feel like you were back in the moment. So trauma can kind of rear its head at unexpected times. It isn't always a flashback like is pictured on TV or in the movies. You're not necessarily ducking and covering. Sometimes it's an emotion that doesn't make any sense in context. And they can be triggered by strange things that we would never expect. Times, smells, sounds, places that remind us of things, people whose voices or actions or even relationships that seem similar. EMDR uses bilateral stimulation, which just means both sides of the body, we're doing something to it. Often it's eye movement, sometimes tapping, and it does this to kind of help the brain process those stuck memories. Which allows us to desensitize those painful feelings, those extra emotions that we get, or sometimes even physical reactions that we've associated with it, so that they no longer have the same charge. So that memory is no longer hot. Now, therapy should never, ever be one size fits all. If somebody has a box and they're determined to stuff you in it, run like heck. And I'm not saying that EMDR is the only thing that works or is the right thing for everybody. Some people are not appropriate for EMDR. That's why you want a therapist that's good enough at EMDR to know if you should not be getting it. That being said, I specialize in 4 different types of EMDR because some of them work better with different clients. So the first type is traditional 8-phase EMDR. This is the one that most people practiced. It's the one that was developed in the 80s. It's kind of the gold standard, and it uses that bilateral stimulation to kind of target memories, process specific memories. It's very effective for PTSD and phobias. The problem is with traditional EMDR is it is very systematic. Again, that's not a bad thing if you have a therapist that knows the system and sticks to it, especially some of the preparation phases. If you have high trauma, you're going to need a lot of prep before you do traditional EMDR. So you come in, the first session, obviously you're doing your intake. After that, you're doing preparation. You're learning skills sometimes to help you calm down, to be able to regulate emotion so that you can stay in that space with that bad memory. So you are, during most of an EMDR session for traditional EMDR, sitting in that negative memory, doing bilateral stimulation. The therapist is checking in and then directing you and making sure that you're staying in it, not dissociating, not getting too overwhelmed. The second type of EMDR is attachment-focused EMDR. And this is kind of tailored a lot of the times to relational trauma or like childhood neglect. There's a lot of emphasis here on resource building, not resource building prior to EMDR, but resource building as a part of EMDR. So safety, building internal resources, parent relational wounds, and the idea is that when we do that with the past memories, that impacts how we connect with others in our relationships today. The third type of EMDR, it's the one that's my favorite, is the EMDR flash technique. This one's newer, it's about 7-8 years old. It's a lot more gentle and it's faster. There's a lot of good research coming up around it. Flash allows us to process highly distressing memories without having to actually focus on the memory while we're processing it. So 8-phase EMDR, attachment focused, we are sitting in that memory the entire time we're processing. With Flash, on the other hand, I'm going to say, okay, we're going to process this memory. We've identified it. Now, we're not going to think of that. We're going to think of something else. So we're going to end up in a positive space. They may be watching a YouTube video. They may be looking at pictures of their dog or even talking to me about a past vacation. And they're doing the stimulation during that. So instead of sitting the entire session in the negative memory, they're setting the majority of the time in something positive. And then we check back in occasionally to see how that memory that we're processing has changed. So it's kind of processing it offline. And over time, the heat around that memory again goes down. I like Flash again because it is much less upsetting. I've done all of these as a client. You do them as a part of your training, but I also like to go seek out and see what things are like from the client end. And if I had a choice, I would always do Flash just because it's faster and to be blunt, it sucks less. The next one that I like as well is EMDR 2.0. And again, it is also an update, as it sounds, to traditional EMDR. It is based on working memory theory. So the idea behind that is that your working memory has a limited capacity. There's only so much there that you can use. So when you're doing EMDR 2.0, the goal is to tax the working memory so much that the memory that you're processing starts to degrade. It's becoming less emotional, it's becoming less vivid, it's becoming less upsetting. And there are a lot of ways to do that. Different therapists may be using eye movements, spelling words backwards, counting, complex tapping, singing. I've seen so many things that you can do with this. And again, this is closer, it's sort of a halfway between 8-phase EMDR and the Flash technique. So it's kind of working on some of the same principles as Flash, that we're kind of overloading the client, trying to keep them, their memory busy enough that, things are degrading as we go. And again, the nice thing about EMDR 2.0 is it is faster and it's more tolerable because you're not having to sit straight in the pain of that really bad memory that we're trying to process for the entire session. And again, EMDR is a wonderful tool, but sometimes it's not the only tool, and it shouldn't always be the only tool. In my practice, when I do choose to use EMDR with a client, when I think the client is appropriate for it, I often integrate EMDR with other evidence-based models, with other types of therapy. For example, in my doctoral research, I look closely at the intersection of EMDR and relationships. So, when individuals heal the trauma, their relationships change. We have some good research around that for couple therapy, that when an individual has EMDR, they interact with their partner differently. So, by blending EMDR with certain couple therapy or relationship therapies like Gottman method, emotionally focused therapy, structural family therapy, we can look at individual trauma as well as the interaction patterns that keep couples or families stuck. And also if we're navigating PTSD, anxiety, or relationships, the goal's always kind of the same. We want to find the models that work best. So again, it may not be EMDR. It may not be EMDR alone. A client may come to me and I may look at them and say, hey, this one I could solve quicker in hypnosis or in DBT than I can with EMDR. Other clients, I may say, hey, I don't think you're prepared for EMDR. We may need to do something like dialectical behavior therapy to get you some skills before we do that. Because again, the goal is always to work on the problem that's hurting the most. And sometimes when people have a high level of SI, other things, they may not be appropriate for EMDR. And also with EMDR, I personally see a lot of clients who already have talk therapy, and they're stuck in talk therapy in either trauma-focused CBT or DBT or something else, and they're just not moving forward. So I will pair with their therapist, they'll send them over, we'll remove whatever blocker is keeping them from moving forward in their talk therapy using a few EMDR sessions. Then they go back. They may see me the same week they see the other therapist. They may see me for a few weeks or even a week or one long marathon session to get the block out of the way and then continue with the talk therapy. Thank you so much for joining me today. If you're ready to explore how we can work together, move past some barriers keeping you stuck, and you live in Ohio, please visit my website or reach out directly. My office is located in Columbus, Ohio, and I see clients in person in Columbus or via telehealth throughout the entire state. Have a great day.